Welcome back. My name is Dr. Dean, and I'm here with my friend Brandon. And we're going to be discussing now Correct System Drill Step number 4, which is the side step. So this is the first time we're actually going to be moving, right? So everybody's like, oh, well, these drill steps you're doing, you're just standing there, right? And how's that? But this one, you're going to actually get to move a little bit, all right? Okay, so the side step is designed to be very specifically to get the athlete to move sideways, but be able to equally distribute their weight, right, between the 2 feet, right? So we say, now just because we're moving, right, we're actually taking steps, why are the Correct drill steps what they are, right? Well, if you're an athlete, you need to be able to turn your body, right? And not go into that. We talked about that knee fault, right? I need to be able to get low, but I need to be able to get low and not, right, lose spinal stability, or get low and not have to, right? I've lost ground force reaction because I can't put my heels down. Athletes need to be able to turn and drop, but they also need to be able to move sideways here. They need to be able to move back here, move forward, here, right? They need to be able to change direction, right? I need to be able to drop back, and I need to be able to move forward. So what we say is the athlete needs to be able, from wherever they are, move in any direction. And all of those are Correct System drill steps, right? And this classic, that lunge, right? Opposites in the front, that lunge position, that's the safe position. You wouldn't want to be here, right? Nobody walks like this, right? That's a good example. Okay, so we're talking about the side step here. We're going to start, again, just very quickly, the setup and the execution. So the setup is the plan of plan and map. The execution is the map of plan and map. So we're talking first about engaging the inner unit, that respiratory apparatus, and then the myofascial slings. We talked about cross the body from one side to the other, and from high to low, low to high, right? And there are many combinations of those. And they don't just happen in the center of the body. We talked about how that creates spinal stability, which is also spinal mobility, and how ground force reaction and torsion, load, and shear at the joints all accumulate into the athlete's experience, right? So your body is reading what's going on. And the more you understand how to read through more planes of motion, the less chance of injury and enhanced performance, I would even say, right? Okay, so now we'll talk about the execution of the plan and map. This is the map part. So we need that conscious athlete readiness, right? We need, make sure we're doing the tenets of Correct System, proximal to distal, quality and consistency, specificity. We've already gone over this. Okay, so now let's just jump right into side step, okay? From the core neutral position, go. Good, so he's got all the 120, 120, 120, right? So fingers are flared up. His hands are wider than his shoulders, so we're just doing a quick quality check. Okay, so Brandon is going to sidestep to the left, and he's going to do one of many arm variations. It says a double block to the rear, so we've already done this with the squat. So on cue, he's going to sidestep, go. Double block to the rear. Good. So the first thing we're looking for is that there's not an excessive step, right? So you just stay where you are. I'm just going to mimic you here in core neutral. So what we're avoiding is this, because Brandon, I can't get out of this. I can't come back up. And then although it's very exciting to get, really take a big step, you can't come back up from that. Number one, okay? Now, number two, when you went into the side step, did you round? Right? Or did you stay in that lumbar core neutral? When you step to the side, did your hips, show them what we're trying to avoid. Did the hips shift, right, over to the side, and then we get that break in the knee? So two things that happen is the athlete or patient in the side step tends to step and lean and or step and lean and turn, right? So we're trying to just stay in that flat plane. Okay, so core neutral, go. Side step left, go. Good, and then this is the double block to the rear pattern with the hands. And then neutral, side step to the left, and the same side that you're stepping to, that hand's gonna go back, and this hand's gonna go forward. Go. Good. So you'll notice he got a nice little bit of rotation in the upper body. You notice that he pulled the straps between his knees so that his hips are in neutral, and then we're just gonna check and make sure he feels like, right? So that's a tactile cue, right? I'm just gonna oscillate his hips to see if he feels like they're in the middle of his knees and that the knees are clearly charged out and activating the glutes. This hand is placed back, and make sure also, even in this position, that the elbows are at 120 degrees. Step back into core neutral. Good, now Brandon, you're gonna side step to the left again, and the opposite hand is gonna go back. So the right hand is gonna go back, the left hand is going forward, go. Yeah, so that's kind of a little mind bender.
That was a mind bender, yeah.
Yeah, good. So again, when you give them these complex cues, or we say arm variations, the point of that is to get the patient to crunch all the numbers up here so that these are the kind of motions or these actions, these shapes, are what happens spontaneously when you're on a field or you're on a court, right? You're not thinking about it all the time. I'm holding you in this position for a reason. Okay, now you notice his left hand has started to drift in. So we want to make sure, right, that he's clearly pressing forward, right? And then clearly pressing back or slightly down. Good. And take a big breath in, exhale back to neutral. Yeah, and then relax, Brandon. That's great, okay? So let's just do a very short set of 5 side steps to the left from core neutral with just the double block to the rear, okay? Okay. There are many, many, many arm variations that go with this, okay? So come to core neutral. Good. And then just as he gets a little tired, the hands are going to start to drift in. Good. Side step to the left, neutral, left, neutral, left, neutral, left, neutral, hold. Yeah. And then on this one, last one, number 5, I want you to go as quickly as you can and hold. Go. Neutral. Good. Now on this one, Brandon, I want you to sidestep and come back to neutral immediately. Go. Good. That's a real thing, right? Yeah. And again, go. Good. And we're looking for quality of, so he's just a little bit tired, right? We're just making sure that the knees are still charged. The position of the core neutral, we call this ending core neutral, has super high quality, even though he's a little fatigued. And take a break. Right. That's good. All right. So let's talk a little bit about the side step. So side step, we'll just use the volleyball. Okay, side step is a good example of the possession positions. Okay, so not that you're going to possess in a volleyball,
right?
Right. But we just like it because it shows up really well on the camera. Okay, so you're going to start in core neutral. Go. Nice, good. And you're going to flex your hands up. Yeah, and then you're going to possess with a side step to the left hip. Go. Good. Neutral. Right shoulder. Go. Neutral. Side step, right, possess to the right shoulder, go. Neutral. Side step left, possess to the left hip, go. Neutral. Side step right. Neutral. Yeah, so you want to make sure they don't automatically pull the tool in the direction without a cue, right? And take a break. Good. So what we're looking for specifically in any of the side step patterns is that there's a nice little bit of rotation here, but then when they rotate, the foot doesn't turn out and that the body doesn't excessively rotate, right? So you have to watch for that foot, okay? That's great. All right, so also about the rotation element that's in the side step, you can cue or treat with it and without it. It's not completely necessary. All right, great. So we will see you on the next Correct System drill step. Thanks so much, Dr. Dean and Brandon. Let's look at the side step. So the side step evolves from the core neutral position. Elbows are down, fingers are up, fingers are wider than shoulder width. Feet are apart comfortably, toes pointing mostly forward. They can be angled out a little bit as well. The side step evolves to the side. Neutral, neutral. I want you to notice how I pull my legs apart and charge the leg intensifier. And then I'm very careful when I come back not to continually bring my hands closer and closer to get that sort of rebound, right? From the neutral, accelerate into deceleration. And notice I'm not taking a big, huge step, right, that I can't get out of, right? Neutral, side step. This is the double block to the rear combination. Notice my knees are pulled apart, toes are still forward, shoulders are back, and I'm making sure I don't go into extra extension in my lumbar spine. Neutral. Just changing direction. Okay, now, arm variations. When I step to the side, I'm going to take the same hand back. Now, what happens when you take the hand back, right, the patient, your athlete, the foot tends to follow the hand, right? So remember, this is disassociated combination to an associated drill. Now this time, instead of going back, I'm going forward with the same hand, right? Different combination, external rotation at the GHJ. What does that look like? I just need a ball here, right? Or I could use my tennis racket. Same thing for an overhead. Okay, now, combinations, the drive. Neutral and release. A couple of combinations using the side step.